Osteoporosis is a condition where bone mass decreases, causing bones to become thin, weak, and easily fractured. About 90% of bone mass forms during puberty and from age 35. Bone mass gradually decreases. For women, bone mass decreases very rapidly around age 50 during menopause. Bone density loss occurs most rapidly during the 3 to 5 years after menopause. Osteoporosis is diagnosed using T-scores from bone density tests. A score above -1 is normal. Between -1 and -2.5 indicates osteopenia, and below -2.5 is classified as osteoporosis. It's important to understand that osteoporosis isn't cured just because your bone density score improves once. Continuous management is necessary. Treatment methods for osteoporosis include calcium and vitamin D intake, weight-bearing exercises, medication, and ongoing risk factor management. Walking, climbing stairs, and strength training are particularly helpful for strengthening bones. For prevention, it's important to consume balanced nutrients like calcium and protein. Starting from your 20s to 30s, be careful with excessive meat and salt intake, as they can cause calcium to be excreted through urine. Exercise is essential for maintaining bone health, with strength training being especially beneficial. The recommended daily calcium intake is 700 mg for adults and 800 to 900 mg for growing children and adolescents. So what foods are rich in calcium? Let's first talk about milk. While milk is known for good calcium absorption, it may not actually be the best food for osteoporosis. Interestingly, statistics show that countries with high milk consumption actually have higher rates of osteoporosis. Dr. Sinya Hiromi claims that excessive milk consumption can actually cause osteoporosis. The theory is that drinking milk causes blood calcium levels to spike suddenly, leading to the excretion of calcium and other nutrients as a reaction. Anchovies contain more calcium than milk, but have lower absorption rates and high sodium content. Tofu becomes rich in calcium due to the coagulant used in the manufacturing process, but may potentially be a GMO food. Dark green vegetables like kale and broccoli have high calcium content with good absorption rates, making them good foods for osteoporosis. Seaweed is also rich in calcium, but may have heavy metal contamination issues due to ocean pollution. Dried vegetables are considered among the best foods for osteoporosis. When vegetables are dried, their nutrient content, including calcium, increases significantly. Dried gandre contains more than 3 times the calcium of anchovies per 100 grams. Eggs are also good for osteoporosis as they contain calcium, vitamin D, and vitamin K2, providing a set of nutrients necessary for bone health. Eating about 2 eggs per day can help maintain bone health. For calcium to benefit bone health, it needs to not only be absorbed, but also move to and attach to the bones. Vitamins D and K2 play important roles in this process.